UMass Memorial Medical Center to talk to us more about the skin cancer. So, Dr. Goldberg, what should people do to protect themselves?
Well, there are really a few things that everyone can do to protect themselves. Most importantly is avoiding peak hours of ultraviolet, which really are between about 10 and 3. We don't want people to avoid enjoying the outdoors, so in addition to that, wearing protective clothing, especially hats, sunglasses are important, and then areas that can't be covered with protective clothing should be covered with a good broad protection sunscreen that has an SPF of at least 30.
So is it still too early in the season for sun to damage our skin?
It really isn't. You know, even in the winter, there is still ultraviolet light that comes through, and even on a cloudy day. So, for example, someone who went skiing in the winter where you don't think about getting a lot of ultraviolet still has the potential of burning. So it is something that we have to think about year-round.
Well, so is it safe? A lot of parents are worried about putting sunblock on their kids because of chemicals, possibly. Is it safe for parents to use sunblock on their children?
That's a very good question, and generally what we tell people is not to use sunscreen on infants less than 6 months old. Really, one of the primary reasons for that is that we don't want young infants to be getting sun exposure. So for infants under 6 months of age, they really should be kept in the shade. For infants 6 months of age and older, sunscreen use is appropriate with the same guidelines as we would recommend for an adult. For people who are worried about some of the chemical ingredients in sunscreens, there are ones made for children and for sensitive skin that have physical blocking agents that are inert, things like titanium dioxide and zinc oxide, and those can be used very safely.
Now, I know this has happened to me, and I'm sure it's happened to a lot of people. You put sunscreen on, but you still get burnt. Is there anything that we should do about that? What happened?
Absolutely, and there are a number of explanations for why you may still be getting a burn even though you're using sunscreen. One reason is that we're not really instructed on how to correctly use sunscreen, so it's not enough to just get the bottle of SPF 15 or 30 and put a little bit on. Really, getting that adequate sun protection, that SPF that's written on the bottle, is related to how much sunscreen you use. So for a typical adult, in order to get an SPF 30 out of an SPF 30 sunscreen, a full body application is actually an entire ounce. So a typical bottle of sunscreen should really last you only for a few days or a week if you're out there every day. So most important is to make sure you have a high enough SPF, so again, minimum of a 30, and to make sure that you're really applying it liberally, putting it on early, so 15 to 20 minutes before you go outdoors so it has a chance to be absorbed or activated, and then reapplying frequently.
Now, what if we get a sunburn?
Once you have a sunburn, there are some things that you can do to make yourself more comfortable. Cool showers or cool compresses are helpful. Some people find things like aloe vera soothing. And if you can use non-steroidal medications like ibuprofen, that can also be helpful. But obviously, most important is to try to prevent the sunburn.
Well, thank you, Dr. Goldberg, for talking with us this afternoon about sun safety. Now, if you have a question out there as a viewer, you would like to ask a medical professional during one of our live Skypes, just email us at housecalls@cbs3springfield.com.